Welcome to the PharmaSource podcast. Today's episode is a CDMO session with CARBOGEN AMCIS. I interview EVP Stephan Fritschi about how they approach contract manufacturing, the services they offer, and advice on how to create better partnerships with pharma. Stephan, very good to meet you. Would you mind introducing yourself, please?
My name is Stephan Fritschi. I'm Executive Vice President Business Units. We got different sites worldwide, and I'm operationally responsible for the operational sites in our corporation, CARBOGEN AMCIS. In my function, I'm overseeing all the interactions and activities in our company, and what we are specialized in, of course, like this topic today is in CDMO business. We are specialists in providing services, in developing chemical processes, but also processes to produce drug products, chemical processes to produce drug substance, and then we provide also the final product, where we have a site in France. A part of the French site, we got a site in Switzerland consisting of 4 factories, one in the UK, one in Veenendaal, which is in the Netherlands, and one in Shanghai. And our operations is covering all the sites there, and depending on the nature of the product and projects, we run our activities also in between sites with each other, or on a single site and send the product to our customers. The activities we are doing is in principle classical organic chemistry on the drug substance side, in a batch mode normally. We cover all the known chemical organic chemistry, and we also do apply new technologies. We come later on to this topic a bit more. We got chromatography, with what we can handle up to production scale, but also ADC as a more modern technology in our area.
And you support your customers all the way from clinical trials all the way to being released on the market. Why is that important?
Well, it is for numerous reasons important. You're right, we are starting our relationship normally with the clients at the very early phase, and then we build up a trustworthy relationship with our customers, and this lasts normally maybe 5 to 10 years until we develop the chemical processes up to a stage where we can call it commercial. So that's the ultimate goal, that we can accompany our customers from early phase through all the clinical phases up to commercial production. And finally, if everything goes fine, the product is successful on the market, we can produce commercially and enter in a new era with our customer. This is on the drug substance side, and on the drug products, we doing the same. We just recently opened a site in France where we can handle highly potent compounds up to commercial phase as well. But again, we start very early and end up with a commercial production.
And congratulations, I should say, for winning your recent award, which was at the Chemistry Industry Awards. Could you mind explaining why you won that award, please? And what was it that achieved that sort of efficiency improvement?
Yes, this happened in our UK site in Manchester. And there we are very long time on that location. It's about 40 years since we started there, and a lot of processes are maybe a bit were aged, and I mean operational processes, and we reviewed the progress and the processes, and we're looking for efficiency gains, and this is from different areas. Let's say how we handle waste material, where we optimized our processes that we can recycle material, recycle solvents, but also where we optimized our shift system, our working pattern, where we can now cover also 24/7 to reduce the cycle time. This was new in our site, so we increased our efficiency and productivity by about 30%, so which is quite remarkable. We also improved our interactions in between departments with the analytical and the chemical development, but also in production. So this is all in all, it's an achievement we have performed over the past 12 months. So again, this is very remarkable. In a short time, we have achieved this goal.
Looking at your sustainability report as well, I saw that you're 100% renewable electricity at some of your sites, which is also a great achievement. How did you go about that, please?
Well, this is an endeavor specifically in Switzerland, where we got the 4 sites, where we had to start this work years back, even before it was really popular in the media. We had long-term negotiations with our suppliers. It was quite successful. So Switzerland is a good place to achieve this because we have a lot of hydroelectric power plants, and therefore we have long-term contracts with our suppliers, and this is how we can could achieve this. We also now looking into more photovoltaic environment equipment to invest into this area as well, so that we can produce then our own electrical power. At the moment, we are collaborating with our suppliers.
When pharma companies come to you, is it generally because they're looking to make that kind of improvement in sustainability or efficiencies, or do they tend to work with you around areas like cost savings, which are obviously so important right now? We're in a time of high inflation. How do you think about making the right balance between those type of business imperatives, sustainability, cost reduction, innovation? How do you create a balanced offering?
Well, it's an interesting question. I think over the past 4 years, so many things happened in the industry and in the world that it's kind of a combination of everything. First of all, the trigger and the motivation of our clients is predominantly they want to have a new product in their hands. They want to develop something new, a new medicine, new drug. And so they're looking for specialists who can provide these things. Of course, then in parallel, over the past, especially past 12, 18 months, inflation is a big topic. So we need to have cost control everywhere, and the customers are very sensitive towards this. And there the efficiency increase comes into play, that we offer solutions which are worthwhile and valuable for our clients. And they see that they can achieve their goal, not only cheap, but in a relatively short time. It's not only about the money they spend, but also how long does it take until they get the final product. The final product is, of course, the material itself, but also all the information about the chemical processes or the processes how to develop and produce the drug product. So it's all the whole package which is important. Also, what is needed to go to regulatory affairs, to the authorities, to file a document, and so on and so forth. So all this comes into play when the customer wants to achieve and obtain a new product.
How do you foster a culture of innovation within the CDMO? What are the methods and tools you use to come up with new ideas and new solutions?
Yeah, this is not really something new. Innovation is something what CARBOGEN AMCIS was for a long time active in, applying new technologies. For example, can give you an example, simulated moving bed, SMB. We started to offer this service in the late 90s, where the industry and technology was not very familiar with this technology. But in that time, but also today, it was very beneficial to our client because it's a very rapid very rapid method to provide chiral compounds, optical pure compounds, and this is how we made this that time. In the meantime, of course, innovation is even more crucial, and that's why we have a standing group with people, a set of people who are reviewing the market, reviewing the literature, talking to clients, potential clients, and go to symposia to see what is new in the market. I can also give you an example. We started some years back with the flow chemistry, continuous flow, to produce not only in a more efficient way new products, but also using this application to run processes which are maybe more risky from a safety standpoint, or they're just not valuable to be run in a batch mode. So there we have started a project about 3 years ago. We developed the chemistry and we went through the clinical phases. Right now we are in the validation phase, meaning that we had to develop all the cleaning and the also discussion with the authorities, because authorities are not very familiar with continuous flow. So we had to discuss with them and develop also what kind of filing and information is needed to provide this information to the authorities. So now we are at the doorstep to run a commercial process with continuous flow.
Will that open you up to a new market, do you think?
Well, this is part of the motivations because there are new chemistry steps which can be done in a batch mode, but not very efficiently. So this opens a new segment. It's maybe not the huge trends in the industry, but there's more and more chemistry steps which are a bit cumbersome in the traditional way of working. So we can offer these services and also show the customers that a new thinking is sometimes valuable to reach the goal.
Stephan, I wonder if you could talk about some of the best practices that you've experienced in how to partner with other pharma organizations. I don't know whether you can name names or not, but it'd be good to know, a few examples of what a good collaborative partnership looks like and how that type of partnership can address some of the things we've talked about. So cost control, sustainability, innovation.
Mm-hmm, mm-hmm. Of course, I cannot name any companies because this is one of our principles. It's not only the material and product IP, but also confidentiality that the customers understands is exclusive to us, and we take this very seriously. The topics you just mentioned are very important. So what kind of agreement do we have with our customers? First of all, we listen what the goal is, what the customer tries to achieve. And then we can tailor the agreement. So we have from a single PO contract through a framework up to FT work. So this is the different kinds of collaboration agreements, depending on the customer. The more flexible he would like to have it, the more we go towards the FT agreement. FT agreement is the most flexible one, where he can allocate the resources to his desire. He can say, over the next weeks and months, I'm working on this target, and he can switch the resources on short notice to other targets if he has changed his mind, which is quite often the case. On a PO basis, it's more fixed. So we have a target, we achieve this, and then it's done. The cost control is, of course, very important. We provide track sheets where the customer sees how much money he has spent, where does he stand, and if there are deviations, we are looking for an early conversation with him to talk about the best solution. Either we rearrange the target or we talk about a new agreement.
What about bad partnering? Are there any examples that come to mind of where a partnership hasn't worked as well as it could, and why was that?
Yes, bad partnering, I would like to rephrase it in a way which is more, what is a good partnership? Mm-hmm. Good partnership is if you have a trustworthy and an open and transparent relationship where you can talk about problems, what pop up, cumbersomes or challenges, and you can talk about solutions. Where the customer is reluctant to, for example, to tell us what he has already done. Sometimes there are customers, specifically at the beginning of a collaboration, he thinks, yeah, it's maybe just important to know the synthesis, and we need 5 kilograms or 50 kilograms of material. That's all. But then there is a risk that we duplicate the effort, that we repeat what the customer has already done, not only the good results, but those are the pitfalls. The more open the communication is, the better and more efficient the collaboration is as well. So this is maybe answered your question in a different way. So our desire is to have a transparent and a proactive communication and collaboration with our clients.
Yeah. While secrecy is understandable in such a competitive industry, it makes it really hard, doesn't it, I guess, to advise and recommend the right solution?
Absolutely. Of course, we just need the information which is determined and important to our task. We don't need to have all the information about the drug, how the clinical results look like, and the details of these things. But in terms of chemistry, it's important that we understand what happens, what has been done, what failed. Sometimes failure is more important than what is the right way, because from the failures you can learn, and then you can define the right way how to go forward. And then eventually you can step into PPQ and validation of the process.
Great, thank you. How do you tend to handle clinical trials and regulatory affairs? Do you have a separate department within the CDMO to look after that? How do you approach it?
Yes and no. Start with the no. We do not run clinical trials. This is done by our partners, by the clients. We deliver the material, and he's performing and executing the clinical trials. And in this perspective, it's very important that we are on time, because he has slotted in his tests, and so we need to deliver the material. The yes refers to the regulatory affairs. So we have a standing group, specialists working for decades in the area. We can consult our clients. We discuss with the customers about the strategy, what kind of data, what kind of experiment should be done, that we or the customer can file the documents with the authorities. So it's depending on the customer's wish, we can file or the customer files them. But we are consulting and executing the writing and providing the information to the clients.
Great, thank you. If you were to look out over the next 12 months or so, what's coming up for CARBOGEN AMCIS? What's in the pipeline? Is there anything which you're able to talk about, which you're particularly excited about, things which you think are going to bring something new to the industry?
Yes, again, I cannot mention the name, but I can describe what we have done over the past years, and especially for the next 12 months, we are awaiting the breakthrough in terms of commercialization. That's a project we started about 5 years ago. It's about 11 steps in total, and very complex chemistry, starting from a non-high potent compound and ending up with drug product, and the drug product is the antibody drug conjugate. And what we have done, we involved all different kind of sites. We started in Manchester, for example, where we run non-GMP chemistry. So they produce the intermediate. The intermediate goes to one of our Swiss sites, where we do the first GMP steps. From there, it goes to a third site to produce the warhead, so-called warhead, which is the active part of an ADC. And from there, we go into our ADC suite in Bubendorf in Switzerland. And those guys, they produce the aqueous solution, which is then provided to our site in Saint-Beusier, where we do our drug product. The drug product, the solution, is put in vials and lyophilized to dryness, and then it goes to clinic. So this is quite an exciting product and project we have, because it involves a lot of chemistry, a lot of different technologies, highly complex. And the beauty of this is that we have one single point of contact for our clients in terms of project management. But the client has the possibility, if desired, to talk to each individual site with different aspects and a different focus. So it's quite nice work.
You're describing a very European network. Have you found that Brexit has caused any issues, particularly with your Manchester base?
It's an interesting question. The biggest impact is the administration and the paperwork we have to do. Luckily, we were pretty well prepared what could happen. So our supply chain, specifically in the transmission phase, we prepared everything. We took material on stock so we could smoothen the bumps a bit. And meanwhile, operation has settled down in the sense it's smoother now, but it's still more cumbersome than before. But it works. Similar situation, maybe talking about European centricity. We got a site in Shanghai. There, of course, we have similar issues or challenges in terms of administration and financial impacts, that we can take materials to there or from there to back to Europe. But meanwhile, we're quite experienced to this work. So we have a lot of experience to organize and manage also the supply chain across the countries, from UK into Europe, into Switzerland, which is also not part of EU, but also to different continents like China.
Great. It sounds like you're finding your way through it.
Yes. The exciting thing in our business is that we are at the forefront of the technology, and not only on the chemistry part of everything, but also on the medication part, in the clinics and so on. We see where the trend goes to, and this is very exciting. So this is something which is going forward and progression. And of course, part of the reason why the industry is pretty wealthy at the moment and healthy is because of the pandemic. The people understood that medicines, drugs are very important to humans, and therefore we can be grateful that we got people like the guys in the pharmaceutical industry, but also for people in CDMO business to give support to this.
Do you feel like you're making a difference? When you go to bed at night, do you feel as though the work that you're doing is for the good?
Well, of course, not every night thinking what a great day. But if I lean back a bit and look what we have achieved over the past months and years, I can say yes. And this is really something which makes us proud. Every individual and every employee in our organization understands that he can make a difference with his work or her work. They can make a difference to people's life, because these are new applications. Sometimes we really know where the drug goes into. So even sometimes we know the patient. So it makes a difference. It can make a difference, and this makes us proud, but gives also sense behind the work.
Stephan, thank you so much for your time.
You're welcome. Thank you.
To find out more, head to carbogen-amcis.com. Keep up to date with the latest events in the PharmaSource community at pharmasource.global/events.